Hi, my name is Trent Harris. I'm a physical therapist at Wise Physical Therapy and Sports Medicine in Grove City, Pennsylvania. Today I want to talk to you real briefly about elbow pain. But today it's going to be more specific. I want to talk about more lateral elbow pain, or pain on the outside of the elbow, called lateral epicondylitis, or another name for it is called tennis elbow. Now, tennis elbow is kind of a misleading name for it because only about 5% of all individuals who suffer from this type of condition are actually actively involved in playing tennis. This condition is more common with people who are performing overuse activities, repetitive activities. It's most common in the ages from 35 to 65, and the reason for that is because it's more common in people who are in the workforce, in the workplace. People such as carpenters, plumbers, people who are typing on the computer every day. Those are the people who are more common or more susceptible to this injury. Now, what is lateral epicondylitis? Lateral epicondylitis, to explain that, I'm just going to give a quick little anatomy lesson. On the top of your forearm, you have a group of muscles called your wrist extensors, and they're responsible for performing this type of motion right here. So you have 5 muscles here on top of your forearm here that come up, and they all attach up into that bony area on the outside of your elbow. And what happens is these tendons, if they get overworked and overused, these tendons can get some inflammation around those tendons, and it becomes more like a tendonitis. However, if that inflammation is not controlled, then what happens, it becomes more like a tendinopathy. And what that is these tendons become more inflamed. The tendons then you can start getting micro tears of the tendons, and then eventually scar tissue forms, and that's what causes your pain. Some symptoms that are involved with lateral epicondylitis include pain. Pain is the #1 symptom. And people typically will say they get pain with trying to extend the elbow out. They'll get pain with wrist extension, but they also sometimes can get pain with raising their palm up and down. People sometimes will complain that they have pain in the elbow with gripping activity. Sometimes they complain of a little bit of numbness in the hand. That's also a symptom. You can also actually sometimes see visible swelling on the outer part of that elbow. Now, to diagnose this condition, you can either go to your physician or to a physical therapist. Physical therapists can diagnose this condition. As physical therapists, what we do is we obtain a good medical history on you. We'll be asking several questions. What's your job duties? What do you do on a day in and day out business? And then also people who are active, who do play sports, it is possible you can get that by playing tennis or racquetball or something where you're putting an excessive force on that area. Now, as physical therapists, we also can perform specific tests. We do specific testing of muscles of the wrist, the forearm, and the elbow to determine what structures are involved, and we can isolate if it is a true lateral epicondylitis or not. Now, in physical therapy, what we do is, as physical therapists, we teach proper exercise where you're gently, keyword there is gently, strengthening and stretching the muscles of your wrist, forearm, and elbow. We also perform modalities such as ultrasound, electrical muscle stimulation, and iontophoresis. Now, iontophoresis is a modality. What we use is it's a patch that we put a medication on, which is an anti-inflammatory. We put that medication on the patch, put the patch on the skin, and you keep that on there for about 4 hours, and it drives the medication into that area to decrease inflammation. We also perform manual techniques on patients. So what we do is we do joint mobilizations to help joint mobility. We do joint manipulation along with cross friction massage to help decrease any scar tissue and break up that scar tissue that may be forming in the elbow. And lastly, what we do is we do trigger point or myofascial release of the muscles of the wrist extensors. And what that is to do is just try to decrease any muscle spasms you may be having, but also to decrease tension on the muscles to alleviate some of the pain in the lateral elbow. So if you're experiencing this type of pain, the pain in the lateral elbow, or if you're experiencing any other musculoskeletal pain, please do not hesitate to give us a call here at 724-458-9473. Have a great day.